So here we have the lovely Sherry. She's a speech and language therapist. So you're going to tell us a bit about what you do, how strokes affect people.
Yeah.
Okay, thank
So
you.
I work on an acute stroke unit,
Okay.
seeing stroke patients, and I help to rehabilitate them in terms of their communication abilities and
Okay.
their swallowing abilities.
Okay. So a lot of stroke patients, after they've had a stroke, how does it affect them?
So when you have a stroke, it can affect the muscles in your face, the muscles we use for speaking, and it can result in what we call like slurred speech. Or it can affect, depending on the part of the brain that it's in, our ability to use and understand language. So patients can present with like word finding difficulties, things like that, and we
Okay.
sort of help them use strategies to overcome these difficulties.
Okay, so predominantly the patients that you see or that you care for, are they younger, middle-aged, adults? What do you tend to see?
Generally, I mean, you can have a stroke at any age depending on what kind of medical conditions you have. A lot of our patients are of the older generation. But yeah, it can happen at any age with that.
Okay, so after someone's had a stroke, what's the recovery like in terms of what it affects them in a way that I've seen some people that have stroke problems and it affects one side of their face, correct? Okay, so what is the success rate?
It very much depends on what kind of stroke it is and how big the stroke is, which part of the brain is affected. Other things can play a role, such as the patient's age, things like that, whether they have any pre-existing medical conditions, so things like dementia, things like that. So it's quite hard to predict. It's quite hard to put a time frame on how long it will take to recover, but yeah, with intense rehabilitation, speech therapy, physiotherapy, occupational therapy, dietitians, we all work together to try and rehabilitate each patient.
Okay. So what kinds of, there's different types of stroke you said. What are the different types?
So you get the two main kind of strokes are infarcts and so ischemic strokes, which is basically a blockage of blood flow to the brain, which results in a part of the brain dying. And then you get hemorrhagic strokes, so that's like a bleed.
Okay. So I'm learning myself, so that's
right.
yeah, I've learned a lot today from you. I've learned a lot today from you. Thank you very much for that. Yeah, thank you very much for that.
No worries. You have to go back in.
All right, that's fine. That's fine. I was going to ask you, it's not your area of expertise, mental health. There are, because people always generalize with mental health. They say, oh, this person's got mental health. There are different types of mental health. Do you know the different types, or it's not really your...
Oh, it's not really my area.
Okay.
Mental health, no.
Okay.
We do, some of our patients will have mental health difficulties, so we do have a referral pathway for that to refer them to a mental health specialised team. Yeah, I wouldn't really know.
Okay. What causes strokes? Or how can it be prevented? What can people do?
There are a number of risk factors that can put you at risk of having a stroke. Obviously, lifestyle things like smoking, drinking, use of drugs. Sometimes if you've got a strong family history of stroke, it can be
Eating the right foods?
Yeah, I mean, so
Eating
the
fatty
general
foods?
advice is to have a healthy lifestyle. But other things, so like diabetes, high blood pressure, that can also put you at risk of having strokes. So it's really important to get those things checked out so you can be started on the right medication.
Okay. So it's good to drink a lot of water as well. Yeah? And eat the right types of food, fruit.
Just a general healthy, like well-balanced
diet.
lifestyle.
Okay. Thank you for that, Sherry. Yeah, you've been very helpful, and I know that this will help a lot of people that may have had stroke or they're suffering from things that might attribute to having a stroke later on. So thank you for that. You've been very helpful, man. Cool. Thank you.
Do you